I keep having these conversations with patients that I want you to know about. I saw a patient today who wanted breast reconstruction and she wanted to have a DIEP flap surgery. She's 69 years old and is a good medical candidate for that surgery. She saw a plastic surgeon who just told her, I won't do it. Medicare won't pay me enough for it.
I was told that this doctor would not do a DIEP flap procedure for me because Medicare would not pay for it.
And I hear this over and over. I'm having these interactions with patients, and the individual patient is so important, but the pattern of surgeons denying care, not offering care because of poor reimbursement is one that we really need to address. I want you to know that reimbursement for surgery drives access, and that is a truth, and it's just the way that a market works. So specifically with breast reconstruction, it is true that Medicare doesn't pay well at all. They don't pay appropriately for DIEP flap surgery, they don't. I have taken the stance that I still do the surgery. I still address the issue with the individual, but then I also advocate at a national level and say, this just can't stand. You cannot pay $3,000 for a DIEP flap surgery. I lose money every time. We need to have appropriate reimbursements that the government, and by the way, CMS reimbursements, Medicare reimbursements are the standard by which everyone else sets their reimbursement. So there's a reason why we don't have good access to modern breast reconstruction, and it's because at the very baseline, CMS isn't valuing DIEP flap reconstruction appropriately. And yes, that goes back to the AMA and the whole coding system, and it is all crazy, mixed up, and wrong. When I see patients, individuals over and over for years who don't have access to surgery because the reimbursement isn't there, it makes me fired up to change things. So I'm letting you guys know that we need for CMS to take a look at the way things have been done in the past. We need for this administration to take a hard look at the coding system and the way reimbursements are calculated. And, maybe a new system. I'll let you know that I'm going to take care of this patient. I'm going to do her surgery, even if I lose money on it, because it's the right thing to do. And hopefully that also gives me the credibility to go to DC and to talk to you guys and say, yeah, I'll do the right thing for the individual, but let's all change this for the better.